And welcome back to Open Your Eyes on this lovely Wednesday morning. We are now moving into our first conversation for the morning, and we'll be talking about COVID-19 and how it's affecting the Caribbean. As a matter of fact, with us live from Barbados is the Executive Director of CARPHA, none other than Dr. Joy St. John. Dr. St. John, good morning and welcome with us.
Good morning.
And
I haven't been to Belize before, so a virtual visit is just as good.
All right. Well, I'll tell you what, we will make sure that whenever you're able to get to Belize, you'll be greeted with a warm Belizean welcome.
Yeah.
I'll hold you to that.
All right. So let's get on into the conversation as to, firstly, we've been hearing CARPHA over the past few weeks, and Belizeans are very interested to know what is CARPHA and what it does.
The Caribbean Public Health Agency is the amalgamation of 5 regional health institutions, and I'll give you the names. It's been in operation for just 7 short years. The Caribbean Epidemiology Center and the Caribbean Food and Nutrition Institute were both PAHO institutes. They were merged into what is now CARPHA, along with the Caribbean Environmental Health Institute, the Caribbean Regional Drug Testing Laboratory, and the Caribbean Health Research Council. So we do, at CARPHA, more than usual public health institutions do. Apart from the usual surveillance, we also have food and nutrition, we have drug regulation and testing, quality of drugs, we have environmental health and environmental management services, we have the annual research conference, and so CARPHA has a lot to bring to the COVID situation. Of course, we do NCDs, and so this is part of how we have been looking at how COVID-19 could affect the countries.
You work with countries across the Caribbean, and in fact, very early on in monitoring what was happening globally, helped to guide how much at risk we in the Caribbean were.
Yes, that's right. CARPHA serves 26 member states. Some of them are overseas territories, British, Dutch, and French. And what we did, because we also have a very strong tourism and health program, what we did is that we gave our own risk level assessment based on if there were direct flights from a country of concern or not, based on the number of countries in close proximity that had COVID cases. And so while there was a global threat risk of high and then very high, we did not go to very high until we assessed it was imminent that we would have our first importation in the CARPHA member states. And I think it occurred like 1 or 2 days after we raised that threat level.
That's right.
But we gradually raising it based on not only what I told you, but also we had been looking at some simulations of how it was thought that this virus could spread out into the world. And so we were watching the flight pattern, and we watched it come up from South America. We also watched it come down from North America. And we kind of guess, okay, it's about time it will get to the CARPHA countries.
So in a span of about 2 weeks, we had the first confirmation in the Caribbean March 10th. And now Belize was one of the last countries to be able to confirm its first case. Was this, I mean, in terms of how quickly it has been confirmed across the Caribbean, is this matching kind of the pattern that was expected from CARPHA?
Yes, we figured that we would, once we had the first case in the Caribbean, and we looked at the Caribbean, not just from the CARPHA member states, we looked other member states. So you will notice that there were French territories that had cases first.
Yes.
We were monitoring from March 1st, and we figured that at the point that it started in the English-speaking Caribbean, we would quickly get many importations from many countries in quick succession, which is actually what happened.
Yeah.
So we're going to be looking at the Caribbean outbreak as a continuum, and not from when a particular country got it. So from the time that, from now I'm going to be monitoring for CARPHA member states. So from the time that the first CARPHA member state got it, it has been a very short time to get most of the rest of the countries.
Yeah. Let's talk about the current situation in the Caribbean. All countries have been affected at this point?
Not yet.
Okay, so there's one.
There are some that have not announced.
Yeah.
And there's some that have not reported any cases, any importations.
And what countries are, tell us about the status of the countries across the Caribbean. How are they doing?
So I have always looked at this in 3 phases. Preparedness, which is what we were doing before we had the first importations. Then importation. So we're mainly in the importation phase. That means that the countries are discovering persons who have brought it into their country. Because remember, this is a novel virus, so it has to be brought in from outside.
Yes.
Right.
So they're discovering them, and they're doing contact tracing to ensure that there is not localized transmission due to person-to-person contact. There are 1 or 2 countries that have established that, and not in a large measure. You will know that in Jamaica, there are quarantine areas, so that they have discovered that in specific areas. The next phase will be when we have more widespread transmission. We are not linking cases to travel history or contact with someone who has travel history. And it is at that point that we are fully in the transmission phase.
That's a very important distinction that you made. And if we could just perhaps unpack that a bit. So it is expected, the first phase, as in where we are in Belize, that somebody will bring it in. That's what you call the importation phase. And
so that's why I said your first case is an importation.
Yes.
Because it's linked to travel history. It's not someone in the community who had no connection to travel or to someone who traveled. So it's an importation. So the contact tracing around this case and ensuring that all of those contacts are quarantined is very critical.
Yeah. Would you then say that this is perhaps the most critical time for us to be able to be practicing the preventative measures that have been communicated for the past few months?
Without a doubt, because if persons are not washing their hands, practicing cough etiquette, if they are not maintaining social distance, and some countries have also gone, those are the public health measures. See what I did just now, touching my face? You shouldn't be doing that either.
I know.
Those are the public health measures, and they have been amplified in some countries by targeted government measures to reduce the contact of persons. For example, school closures.
Yes.
Restricting gatherings in numbers. Some people 25, some 10. You have extreme cases in Germany where only 2 people can meet.
Wow.
Yes, but the Germans, although they've had cases, the way they're approaching it, their disease burden is being kept under control. And there are actually models for how you can blunt the epidemic curve, because with a disease as transmissible as COVID-19, there are two types of epidemic curve. One, short and sharp, where there is a big increase in cases, it overwhelms the health services. And one where it's blunted, so that disease does not overwhelm the health services. And I'm talking about public and private sector. And there are two models. One is the suppression model, where you really cut everything down. You do border closures, etc., etc. No congregation in bars, restaurants, churches, teleworking, all of that. Those are extreme measures. And then you have a mitigation measure where you have less restriction. You will have fewer cases, but it may not stop the overwhelming of the services because of the way in which COVID-19 behaves. It sneaks in quietly. Most of the cases are going to be mild anyhow, so mild, they could be undetectable. So you could have spread quickly and never know. Once you're building up a number of people who have mild disease, you're going to get contact with people who are vulnerable. Older persons, persons with lung conditions, persons with diabetes, hypertension, cancers, smokers. And then you start to see severe, which is hospitalization, but they usually recover, and critical, which is where they are so bad they need intensive care treatment. It is that smaller percentage, the 20%, 15 severe, 5% critical. Those are the percentages for disease in other countries like China. Once you see that, that is when you can overwhelm the health services, because intensive care beds, ventilators, intensivists, the doctors who know how to treat in persons in ICU, but importantly, the nurses, because intense nursing care is what saves people. You do not have enough of those. And in some countries, you don't have any. You should have adult intensive care, high dependency units, pediatric intensive care. In your accident emergency, public or private, you should also have people with the ability to do this, and rooms where people can be in an intensive care setting until they can get onto the wards. Many people do not have those in the numbers that COVID can produce.
And the treatment itself, as you are very clearly saying, it is intense and prolonged.
Yes, what was happening in China is that we were seeing people staying on the ventilators for 3 weeks. But now what is happening is that we're seeing them stay on for 6 to 8 weeks. And this is why you will notice in some countries where the outbreak is really bad, you have an age cutoff. They do not put a person on a ventilator. In some countries, 60 years old, you don't get on a ventilator because they just don't have the ventilators to match the demand.
That's right.
You know,
Now, can I just,
Sure.
the issue, and this is where we put it into perspective. A lot of people may look at COVID-19 and say, oh, it's a mild disease. A lot of people will be able to survive it, and that's the truth. But what we perhaps don't speak about enough is the limited capacity of medical care in individual countries, and specifically when we look in countries like Belize. So it's not that we can't treat it or that people won't be able to survive, it's how many we can handle at one time.
So let me put it, you're quite right, and I'm really impressed at your analysis, but let me put another part to this. COVID-19 has two presentations. One which is like the flu, and that's the majority. And then the other is what I call a transmissible pneumonia. And that is the one that needs specialized care, the ventilators, etc. That pneumonia is not something that you get over quickly. So even if in bacterial pneumonia and other forms of pneumonia that you're accustomed to treating, you can give medication specific to the disease and the person can get better in a shorter amount of time. You don't have that. There is no specific antiviral treatment. There's no specific treatment for COVID-19. And this is part of the problem. There is also no vaccine. When we had H1N1 some years ago, there was Tamiflu. So you could treat and the persons would get better, even if they were in intensive care. There's treatment. There are drug trials, there are drug cocktails that are available, but there has been no specified treatment regime which has been proven to be effective, safe, because some people are self-medicating or getting some of the named drugs from a doctor, but not following a careful regime. And we've had around the world poisonings and death.
Yes. That's definitely something that has been spreading as well, and people have been aware that self-medicating and the medication that they've been mentioning about is definitely one that you really need to not do. You need to consult with your doctor. But Dr. St. John, I've been listening to the conversation, and what I got from it as well is that, yes, there are CARPHA members without COVID-19 at this particular point. What is CARPHA doing in terms of advising them to keep it safe? And do you see the likelihood of these people getting it, especially if their borders and their airports have been locked off?
Let me put it this way. CARPHA has been guiding. Perhaps you get a chance to look at our website. We have been giving so much guidance, and we've not only been producing documents, we've been having meetings. We have a CMO chat. The CMOs advise each other as well, what they're seeing, what is working, what isn't working. So we have been, and we've been following guidelines. We have coordination meetings with the American Health Organization as well, following the WHO guidelines and CDC in some cases, especially when we were dealing with the cruise ships.
Yes.
So in terms of this whole issue of how you dealt with how the disease came into the country, we produce guidance for conveyances. So that means planes, any kind of boat or yacht, or aircraft, and of course cruise ships. We gave guidance, we gave people the best science, and then member states made their decisions. But we have also been testing, and we have also been working with the countries that PAHO gave testing capacity, like Belize, and advising them through the case definition and the testing protocol. Because of those 3 phases, we started at first with a case definition which was linked to travel or contact with someone who travel. But we have loosened it up just over a week ago to let people search in their hospitals for severe acute respiratory infection not related to travel. So the member states have to make their own decisions about what case definition and what testing protocol they use in order to make sure that they detect illness in their countries.
What is the testing capacity in the Caribbean? If we look at international news, we know that in some of the more developed parts of the world, they have a protocol of testing as much as possible.
Yes.
In Belize, we were limited at first to 100 kits. Now we have gotten more. But what seems to be the collective standard?
So I can tell you what CARPHA has told the 18 member states that they cover. We have told them most recently that they should test everyone who fits the protocol that we have. And remember that we have eased up the protocol for those not having travel history as well. And for those that have been getting their testing capacity and their kits, because it's one thing to get a PCR machine, it's another to get the kits so you can keep the test going. We have been encouraging them also to test, because this was a part of the outbreak that if you don't look carefully, you will have importations and not know.
Yes.
We were also encouraging them to test. I can tell you that CMO in Belize has been in constant communication, not just with CARPHA, but also with the chief medical officers, seeing what else could happen, what measures could be put in place before they're actually detected to try to limit the possibility of importations. In terms of the testing kits, CARPHA has capacity in the thousands with orders for more, but we're covering 18 countries.
Yes.
We have also advised countries that have asked us, and I will not say which countries they are, of other locations where they can get test kits that match their equipment. And there are some countries that were not given capacity by PAHO initially, and PAHO is now giving capacity, and there are still more who are getting their own capacity separate and apart from PAHO, because PAHO gave equipment, reagent, and training.
But what are your thoughts in terms of how widespread testing should be, especially after the first case is imported?
As much as possible. You also need to understand that apart from the testing, there are some surveillance measures, and we've been encouraging countries from the start. Look to see what is their level of influenza-like illness and compare it to the previous year's numbers or the trends, because most of them would have information for years and they would be plotting trends. What are the trends for this time of the year, or what are the trends for this part of the country? So we've been asking countries to monitor that. So even if they don't test, if they see increases, they should check to make sure. The other thing we've been asking them to do is to check hotspots. Now you've got older persons in nursing homes.
Yes.
They are very vulnerable. You should be checking the level of illness in the staff and also in the old persons. If there are any suspicious deaths related to influenza-like illness or pneumonia or anything like that. And we've also been asking that this be done in the hospitals. So it is up to the member states to have that kind of surveillance, vigilance, the background, as well as to have specific vigilance through the testing for the COVID-19.
You mentioned vulnerable populations as the elderly, one of the vulnerable populations. It's important, I think, to look at how the virus has impacted different parts of the world. In some countries, it's been primarily the elderly that have been sick and hospitalized. In other countries, young people are being hospitalized as well. Is there any kind of guidance in terms of what we can expect in this region for people who will be severely impacted?
So let me put this into perspective. The persons who are more likely to get severe illness and die are the persons with chronic diseases, not just the elderly. And I gave you that profile. So that is why we also distributed for all of the countries over a week ago a profile of their burden of illness in the categories I told you: diabetes, hypertension, cancer, the age groups, smokers. So what we have been seeing more so when the pandemic left China and went into Italy and now the US and the UK. What we have seen, a few things. That first 100,000 occurred at a slower rate because the Chinese instituted measures, lockdown measures. They also had thousands of very highly skilled Chinese come from other parts of China. Remember, China is a massive place. And they built special hospitals. So they had capacity for that very severe and severe and critical illness. And they were able to contain because they kept people home so it could not spread. So that first 100,000, because it was mainly concentrated in the East, occurred slower. When you got outside of China, there was not that attention to the disease and how it was spread initially. And so a wider range of people got this disease early. What happened is that they went home and they treated themselves, and then because they were congregating, a lot more young people got the illness than got in China originally, because China also had I think they had a school break or something like that, so the children were not in school. What we have discovered now in looking at the science behind what is happening is that children do contract the illness, but they do not usually exhibit in large numbers a very severe form of the illness. And so once it came out of China, what may have happened, this is conjecture on my part, is that because they weren't paying as much attention to the spread, that children would have been not seeming to be ill, but spreading it, and spreading it more widely. And because people were not staying home and restricting how they went for food, they were still congregating. Younger people got it in more percentages than they would have got it in China. And so we are seeing younger people from Italy, and this is why they're not putting persons in some regions, because the north of Italy is very bad, but the issues throughout Italy. They're not putting persons on ventilators over a certain age in some regions. Come into Europe, the rest of Europe, US and UK, same pattern. This is a mild disease. We have good health systems. We are not paying attention to how it is spread. We also have more of a focus on ensuring that business continues. And we don't do social distancing or enforce social distancing measures. And so you're seeing, and the other thing too is their mode of transport.
Yes.
In the Caribbean, we do a lot of transport in cars.
Yeah.
Some buses, but we do not have the tube.
Yeah.
We do not have the underground. We do not have the subway. And those are breeding grounds. Because you've got many people packed into small spaces.
That's right.
You've got multiple surfaces that people are touching. It's difficult to keep clean, and COVID lasts on surfaces. So you have certain cultural ways of spreading that you cannot avoid. If you work in, you cannot get in your car. You have to go into the tube. You're going to get it. So these are some of the societal and cultural issues that we have also been watching, because this is very much a disease of human behavior.
Yes.
It is spread. And this is part of the reason why I pay so much attention to Italy.
Yeah.
Because Italy, the Italians are like Caribbean people.
Very
They like
affectionate.
family gatherings. They like to get together to eat and to line. They like fetting. They like hugging up. They like kissing up. And so the culture is the same. So the patterns of behavior are similar. So that's why we've been watching Italy. They have systems that are deeper in terms of what they can do, how many people they can cover at the same time. The doctors, the ventilators, etc., etc. So all of this we have been watching and weighing and trying to advise. But each country is making their decisions.
Yeah.
That's right.
Dr. St. John, you know, you're totally right. The Caribbean is definitely the most beautiful place on earth. All these Caribbean countries, and we thrive on tourism, which,
Yes.
of course, when it comes to getting viruses like this one, comes from elsewhere, doesn't start here at home. And I'm saying here at home from a Caribbean standpoint. What is CARPHA's advice in terms of going forward or moving forward, especially in tourism, for us not to get things like this when if anything else should rear its head following COVID-19?
So before we leave COVID-19, we have to look at this whole issue of these protective measures.
Yes.
Yeah.
So these protective measures are going to have a cohort of people who have not been exposed to the disease. The more vulnerable in the population. So what we have to look at is when we decide to encourage tourism again.
Yeah.
Because I don't know if you've been noticing, but China did not have new cases for some days, and then there are reports of
An imported case.
yes, and putting down the borders of Wuhan, and people moving around again. So there are other countries, not China, there are other countries in the East that are now seeing waves, second and third waves.
Wow.
Because this cohort of protected persons, there is movement from other regions into regions where people were protected, and now you're getting transmission not from outside but from within, but a different geography. So you can have waves. So how we manage this disease over time is going to be critical for saving lives
Yeah.
as well.
Can I ask, because you
When
mentioned,
we talk it, let me get to your question, because this is a very important question. And this is why CARPHA has been working with the tourism industry. Not just for messaging in the early days so people understood what this was about, but also we are working with our tourism partners to do training for frontline workers, so they know how to protect themselves as well.
you mentioned the similarities in behavior between Italians and the Caribbean. Can we be optimistic when we look at our population density in the Caribbean versus what we see in China or Europe or even in the States and United States?
But there are pockets with high density in all of the countries you just said. So the whole issue is not so much the density, but how you work with the density. I don't know if you're aware, but in many countries in the Caribbean, supermarkets, places where people have to go, they've set up hand wash stations outside, or they're giving you hand sanitizer, or they're wiping down the trolley handles with sanitizer. They're cleaning surfaces. So even though you may have a scenario where people have to go, they space it. They only allow a certain number of people in at one time, they space how you line up to pay for your food.
Yeah, we're doing the same
This
here.
is- Right.
Yeah.
So don't look at density. Look at how you deal with the density.
Well,
Because there's always a way to deal with it. And the other thing too is the most vulnerable. A lot of people are locking down their parents. There are nursing homes that are closed to visitors. They're monitoring illness among their staff and so on. So there are ways to deal with an issue.
Dr. St. John, in public health, the greatest challenge is getting people to change behavior. And oftentimes people feed into skepticism or misinformation, and the other extreme, which is panic and fear. What's the right balance what's been effective in helping people to understand that we have a role to play in reducing the spread of the virus and taking action effectively?
So one of the things is the information we give and the way we give it.
Yeah.
Okay.
It should be targeted to special interest groups. It should be targeted to certain age groups. And also the next thing is the enforcement. You cannot have a disease so transmissible without government enforcement of certain measures and punishment when people do not do what they are told. Unfortunately, this is the situation with COVID.
Yes.
And so the constant monitoring of your systems, the constant looking to see what went wrong and improving it. If you didn't have a message that was understandable in English or any other language, change the level of language so that everybody can understand. Have special messages for children, have special messages for teachers. Well, most schools are closed across the Caribbean. But that type of thing. But on top of it is this whole thing about government enforcement. There are some interest groups, there are some faith-based groups that are saying that you must come to church. No. You can gather in your living room with others. The fellowship is not a function of a location or a building. The fellowship is a function of your faith. The enforcement of those people who, for whatever reason, and we're seeing a lot of strange behavior across the world. It's not something specific to Caribbean. Some of this is triggers for persons with personality disorders or some other mental health issue, because there's a lot of mental health and mental illness that can function in a normal situation, but en masse in high stress situations like this.
Yeah.
So some of the behavior and the recklessness is not just someone being wicked, but their illness, their mental health illness, mental illness coming out.
Yeah. And that's also another area that we can expect to see some impact in how healthy, the mental health of people as they are quarantined or isolated or locked down.
Oh, we're seeing it already. Even me, because I'm working so hard and there's so much stress, not sleeping that much because there's so much work to do, I get testy. And I'm not nice when I get testy. But everybody, you cannot be immune to this. There is an information overload. If you turn on the TV, it's COVID, COVID, COVID.
Yes.
As so much a human can take.
And especially when so much is still uncertain.
And so much is negative.
Yes. Dr. St. John, if you were to, there's a lot of people watching. We see the stories coming out of Italy, and it's scary. What do you think will be the most significant step that collectively as a Caribbean we need to take that will make a difference in being more like Germany than Italy?
Germany or Singapore.
Yeah, or Singapore, yeah.
Yes, the testing. I keep talking about Singapore. Testing. The strong public health measures, the contact tracing, the quarantining, the isolation, the geographic isolation, so you keep it contained, and then how that is married with the government interventions to enforce this whole issue of social distancing.
Okay.
But now let's go down to the personal level.
Yes.
Let us be our own brothers' keepers. Do not violate personal space. If you are feeling ill, it's a mild illness, do not come to work, do not go to church, do not go to school, do not go into bars, do not go on the beach, do not say you're going to sweat it out outside, keep yourself home. If you are deteriorating, you call, you do whatever the government is suggesting to you to get attention. Some people have gone to clinics, whatever. Do not just walk into your doctor's office and sit down beside the old granny with hypertension.
That's
We
a
hear you.
very important point.
We
Brother,
hear you.
we need to be our brother or sister's keeper.
Yes.
Very critical point. Just one last thing. What will end the pandemic?
After a phase of extreme illness and unfortunately death, most people, and there's some countries that are estimating that 80% of the population will get it. Most people would have got it. Luckily, most of us would have been mild, but there are going to be some of us who will come into hospital and may be affected if we survive by lung scarring, because that is one of the things that has been seen. I am also hoping that it will end because there was a development of treatment, safe treatment. There was development of vaccine, and it was shared, because we are already seeing that some people have decided that they are going to keep this and use this for profit. So I am hoping that we will not let profit take over. The other way in which this epidemic, this pandemic will end is with a cleaner earth. Because we're not driving around, we're not working, so we're not producing the